different types of kidney surgeries and how to choose the best for you. Okay, in this video, I'm going to be talking about either 4 or 5 different type of kidney surgeries and how you can actually choose the best for you. So, guess the number one I'll be talking about. I'll be talking about the one known as shockwave lithotripsy. Okay, this shockwave lithotripsy is a procedure that is done to remove kidney stone that is actually a non-invasive procedure. Non-invasive means that you're not going to be opening your body, you're not going to be opening your skin. So the stones will be broken down with a shock wave, okay, a wave that is well aligned, okay, directed to the point where the stone is going to help to break down that stone. And this is actually very important for people who have stones that are less than 2 cm. So I tell people that if you have any stone that is greater than 10 cm or 10 mm and above, they're actually going to benefit very, very well from surgery or special procedures as the case may be. And shockwave lithotripsy is one of those procedures that's actually going to help you break down kidney stones, and the person now will now pass it as urine. Okay, so this procedure is available in different parts of the world. I believe it's also available in Nigeria, so you can actually do that to be able to stay free from kidney stone. Then number two is what we call percutaneous nephrolithotomy. This is actually a minimal invasive procedure. Minimal means that a little cut will actually be done into your body, and it's actually very okay for removing large stones. Okay, a small cut done at the back to gain entrance and used to remove kidney stones. Kidney stones larger than 2 cm can actually be removed through PCNL. So number three is what we call uroscopy. Uteroscopy. Uteroscopy is a process by which the kidney stone is actually removed transuretrally. That means a scope is going to be passed through your urethra from the urinary meatus into the ureter. It can actually be used to remove stones in the ureters. You know, stones can actually be in different places. It can be in the kidneys, it can be in the ureters, it can also be in the bladder, it can even be in the urethra. That is why we have, you can also, when it also comes to the kidney, we have the upper pole stones, we have the middle pole stones, and we have the lower pole stones. So, and also the way these things are actually different, that is the same way their treatment approach is actually also different. Then the sizes of the stone, like we have been mentioning in this video, it also differ. So when you have a ureteric stone, you may actually benefit from ureteroscopy. So I've seen somebody, in fact there was a result I actually looked at today before making this video, that I saw bilateral ureteroscopy, obstructive ureteroscopy, obstructive ureteric stones. That means two stones causing blockage on the two kidneys, and I advise this person that what you need is urgent surgery, and because this blockage is already causing severe hydronephrosis. And in hydronephrosis we have different grades of hydronephrosis. We have grade 1, grade 2, grade 3, grade 4. So we also have one they call grade 0 too. So these are done using graded according to, in fact that's another discussion for another day. I think I have a video on hydronephrosis. So if you want to learn more about hydronephrosis, I advise you to go through my video. You'll see a place, I think it was one of the videos I did last month. You can also benefit from that. So we have open surgery. Open surgery is becoming obsolete. Obsolete means that a lot of centers no longer do open surgeries for kidney stones. So, but in the cases where this person has very, very large stone, and this stone is causing problem, and the person may not be able to have what it takes to afford minimal invasive procedures or non-invasive procedures, this person may actually go for open surgery. So a cut is made by the side of this person's body, and an entrance is made into the kidney, and the stone is removed. And it's also very okay for stones in the pelvic region of the kidney, so where the stone is actually helped to be dragged out. Okay, so we have the last but not the least, laser lithotripsy. Just like uteroscopy, laser lithotripsy is also non-invasive, where where the scope is passed through the urinary meatus into the ureter and into the kidneys, and then also a machine laser machine is also passed into the same kidney through the urethra to be able to get access to the stone, where the stone is identified using the camera, the scope, and broken down using the laser machine, and then is now being brought out. The truth is that all this procedure may not, um, the stones may not actually be removed once, okay, especially for all this other surgery. But when you're doing open surgery and this solitary stone, maybe one stone, you can actually remove it. But when there are multiple stones, you may not be able to remove it at once, okay. So that is why both shockwave, all the things I've listed here, PCNL, laser lithotripsy, uteroscopy, uteroscopy, and the rest of them, you may actually need to do more than one sections for you to be able to clear off the stones completely. So that is why it's actually the procedure is actually very expensive. And because I don't know when you will be watching this video, I may not really be able to place a price on it because the price is actually dynamic. So if you need more guidance on kidney stone treatment, and then how do you choose the one that is best for you? You choose the one that is best for you based on the size and the position. So you can't say that one of them is actually the best overall, okay? Because it actually depends on the size and the position. So you meeting with your doctor will actually discuss with you to help you choose the one that is best for you. Then if you're under my consultation or under my program or under my tutelage, you can actually contact me to know the one that I feel is actually best for you. So I'm a kidney health coach. I've been helping people to choose the best procedures for them, and they've had the best amazing results. In fact, we've also celebrate people in our group who had passed kidney stone and who have done kidney stone surgery that became free from kidney stone and it never reoccurred again. Because one of the problem of kidney stone is not just doing surgery and removing the stone, it's not just passing the stone, it's preventing reoccurrence. And most people who have actually used our two-step treatment strategy or who have actually gone for surgeries based on our recommendation, they got better results. And since then till now, they've not had any issues with reoccurrence. So a lot of people who've passed kidney stone often have reoccurrence. So reoccurrence is another topic for another day. So if you know anyone who have kidney stone or who you know anyone who actually needs this information, I want you to click on the subscribe button, share to at least 10 persons because you don't know who may actually need this information so badly. I'm Onovo Victory. I'm your kidney health coach with over 7 years of working experience helping people who have kidney stones to become kidney free. Thanks for watching.